There can be some classic signs of corneal involvement, like blurry vision and a branching dendritic lesion, which looks a bit like the tree-like dendrites of a neuron, which happens on the cornea itself, and this pattern is classic for herpes infection. In rare cases, herpes viruses can spread to the central nervous system and cause meningitis or encephalitis, typically affecting the temporal lobe in individuals of all ages. These can happen from a primary infection, but more commonly happen during reactivation when some of the virus can escape into the bloodstream and reach the brain. When there is brain involvement, a lumbar puncture often has specific findings like an increase in red blood cells, increase in white blood cells, and elevated protein levels. There are also some CT, MRI, and EEG changes that can help to make a diagnosis. HSV can also pass from a mother to a baby. Rather than causing a congenital infection while the fetus is in the uterus, most of the transmission happens at birth when the baby passes through the infected maternal vaginal secretions during delivery. Neonatal HSV causes 3 different patterns of illness, each happening about 1/3 of the time. The first is skin, eye, or mucous membrane infection, where lesions pop up 1 to 2 weeks after delivery, typically at sites of damaged skin, like the site where fetal scalp electrodes might have been attached. The second is central nervous system infection, which typically causes lethargy, irritability, and even seizures 2 to 3 weeks after delivery, and can cause some of the same lumbar puncture, CT, MRI, and EEG findings as that in older children and adults with HSV encephalitis. If not treated, both the first and second type can transition into the third type, which is disseminated infection, where herpes virus causes sepsis and failure of various organs, including the heart and the brain. HSV can cause unique symptoms in immunocompromised individuals, who tend to have more frequent reactivation, more severe symptoms, and a wider range of symptoms, like lesions in the esophagus or lungs. Herpes can usually be diagnosed based on how the skin or mucous membrane lesions look, and can be confirmed with tests looking for viral DNA, like polymerase chain reaction, an antibody response to the virus, or by growing the virus with a viral culture. Although infections typically resolve without treatment within a couple of weeks, there are antiviral drugs like acyclovir, famciclovir, and valacyclovir that can be used topically or systemically to reduce pain and speed up healing. For recurring